Okay, we are going to begin our joint City of Corpus Christi and Nueces County briefing that we do every day on COVID-19. This is Friday. We have a couple of presenters today, including myself, Peter Zanoni, City Manager for the City of Corpus Christi. After I speak, Annette Rodriguez, our Health Director, will speak. She'll provide some additional information on the drive-through testing that took place yesterday and the results we got. And then she'll also talk about the drive-through testing that's going to take place Tuesday. We're pre-screening and getting people lined up for another drive-through on Tuesday. And then most of our time, though, today will be spent getting an update from our scientists, professors, from our great university here in Corpus Christi, Texas A&M University, Corpus Christi. And Dr. Bird will present again today. So I'm going to begin with a couple of updates to the community. And one thing I want to talk about, just to let the community know, is, and it came to our attention today when we were finalizing the Texas A&M folks' presentation, is that the community, and some of us, like the mayor and myself and other staff, we've been at this for 8 weeks. Today marks kind of 8 weeks of day in and day out working on coronavirus and COVID. And for the general community, it's probably been about 7 weeks. And it kind of really gripped our community that first day of spring break, which would have been on March 9th. And but a week prior to that, the mayor and myself and others, Judge Canales and the community were engaging. We met in the mayor's office on a Monday morning, realizing that we had something bigger here than just a flu epidemic or a flu situation. And so the pandemic gripped our community 7 to 8 weeks ago. And I mean, we've done it many times here, myself, the mayor, Judge Canales. We wanted to thank the community and commend the community because we believe our great community has responded beautifully to the situation, and we've made a lot of adjustments in how we live and conduct business and study and so on, and we've done a great job. We know we still have a little bit of way to go. We're not out of the woods completely yet, and there's still a lot more work to do in the transition period as we reopen business and reopen our city. And so we want to keep the great spirit that we have and continue to do as good as we've done in the past 8 weeks, moving forward over the next couple of weeks or months. And our scientists will help us tell us how long that will be. Let me start, though, by reviewing this with the community, which is our drive-through testing results from yesterday. So yesterday in the morning, our public health department, which is a combination of city-county operation, had another drive-through testing operation. We tested, though, yesterday more than we ever have, almost double the number of persons that we normally test. And so we tested a total of 83 persons yesterday at the drive-through site, but we had 0 positive cases. It's real important to point out, 0 positives. The 83 persons that were tested were all negative. And so this is really a great graph. It doesn't mean this will continue. But we wanted to point it out to the community. We know yesterday we heard a lot from the community about testing, and we need to do more testing. We're doing that, and we've relaxed, following CDC guidelines, we've relaxed the criteria that's needed to be eligible to get tested. But we were pretty fired up and excited yesterday when late last evening we learned that we had 0 positives out of that 83. So that's some great news to begin our conversation today. I also want to talk about Monday, just to remind the community, we have our press briefings, but the governor and the president, he's having one right now, but the governor has had several press briefings to help inform the community on matters of COVID, but also on orders that he's initiated for the state for us to follow. We know that this Monday, and I wanted to remind the community, this Monday at 2 p.m., the Governor Abbott, is going to have a press briefing to announce his second step in the reopening of our economy in the great state of Texas. And so our viewers today here may want to tune in. It's covered online. It's covered in some of our local news channels. But he will be talking about his next step. We know that today his order for retail to go, more openings in a to-go fashion, became effective. and some stores have implemented that today, using what restaurants have done for several weeks now. Other stores are able to do this because of the governor's order. He will be he'll be doing that Monday at 2. We wanted to point out and commend and thank one of our local business leaders, Sam Susser. He is one of about 30 business leaders across the state of Texas that are helping to advise the governor. And we were glad to learn that we have somebody right here from Corpus Christi that's on that team that's advising the governor on economic issues and on how to reopen our economy in the state. And the mayor and myself and our intergovernmental relations director, Tammy Embry, had an opportunity to speak with Sam and provide him some information this week that he's carrying up to Austin on our behalf to kind of give our perspective on what it means to us here in the Coastal Bend when it comes to reopening the economy. So we want to just notify the community about that, to tune into the governor's press conference at 2. And then also thank persons like Sam Susser that are working overdrive to help represent the area and help the governor make good decisions in terms of opening up the economy. Just a quick update on first responders. So yesterday we had notified the community, actually 2 days ago on Wednesday, we had notified the community that a fire captain who's married to a nurse who may have been exposed to COVID, who the captain worked with his team on Wednesday. And so we had a situation where we had a fire captain and 6 firefighters who may have been exposed through COVID indirectly through the wife. But she was tested yesterday as part of our drive-through testing operation, and she came back negative. So he, the fire captain, and the 6 firefighters who were in quarantine because of this potential situation were released from quarantine late last night. So at this point, we have 0 first responders, no police officers, no firefighters in any type of self-monitoring or quarantine situation. And in part, that's because we care about our employees, and we made sure working with our 2 great chiefs, Chief Markle on the police side and Chief Rocha on the fire side, that we've done more and more as this pandemic has unfolded to make sure the employees are safe, our first responders, when they go out there in the community, making sure they have protective gear, enough of it to use, and the right type of gear. And so we want to thank the 2 chiefs for doing that, and thank our first responders for doing what they do, and thank also those support staff. I was reminded yesterday that we have our first responders, but they drive cruisers and they drive fire trucks and they work in stations, and we have a whole team of support staff that keeps them going. So we want to thank all those teams to help our first responders. And then let's transition real quick to the stats, and then we're going to turn it over to Annette, and then our folks from Texas A&M. So every day at 4 o'clock, we kind of compile what's happened from the past 24 hours in terms of statistics. That includes any new cases, persons that may have been admitted to the hospital or that may be in intensive care. And so you can see our graph here is reflective of the past 7 days. We're happy to see many zeros in the middle. We have a couple of days where we've had 1 case. And so today is one of those days where our count from yesterday to today adds 1 more case to our statistic. So since we've been tracking this over about 7 weeks or so, we have 92 positives now in Nueces County. And I should say that I did mention and say the tracking of this and that we've been at it for about 8 weeks, but actually our health department district has been testing individuals in our community really since January. Our testing capabilities and the initial awareness of COVID has really been out since January. So January, February, March, we're doing testing and learning about this situation from the CDC. But as we've been tracking it and doing these press briefings, that's been about 7 weeks or so. So 92 persons to date since we've tracked this. We have 1 death still in Nueces County, not in the city of Corpus Christi, but within the county limits. And our distribution of the total 92, when it comes to male, female, it's pretty closely distributed. There's 51% of all the persons that have had COVID are male, and then 49% are female. And then we report on the age distribution of those 92, mostly to alert the community and the public that this virus can infect and affect anybody of any age. And our stats show that. We track this from age 0 to 90 years and beyond. And in each of those categories, with the exception of 90 years and beyond, there's persons that have COVID-19 in our community. And the persons that are in the age of 30 to 50 have the highest number in those categories, although 4 other categories below and above that are not too far behind in those numbers. So everybody needs to be aware that you can get this virus. And then in terms of testing, we know that's important to the community. We continue to test more and more, not just us in our drive-thrus, but in our labs. We're doing the analysis. And the hospitals seem to be as well, and they're reporting more information to us than they ever had in the past couple of weeks. We're just 2 persons shy of 2,000 persons being tested in Nueces County. So there's 1,998 persons that have been tested. That includes through our drive-through and then our labs, as well as the hospitals referring patients, specimens to our labs or a private lab for analysis. So you'll see on our tables that we put online, we also have all this information I'm talking to you about today on our website. In fact, that's been improved over time. But today it shows that we tested 63 persons, and yesterday we had 23 on there, so that would equal 86. And so just a quick number check, 83 persons went through the drive-through testing, and then we received 3 specimens from the private sector to be tested in our labs today. And so that's how we get to 86. So we had 23 tested yesterday in our labs, 63 additional since yesterday at 4 to today, and that gets us to that 86 number total tests. And then let's just talk real quick about where these folks are that have or have had the coronavirus. So of the 92, 77 are within the city of Corpus Christi. That new person that's on our charts from today is from Corpus Christi. So we picked up 1 more. We have 2 in Robstown, 7 in Port Aransas, and then 6 in rural Nueces County. I'm going to talk about the recovery rate, but in the 7 in Port Aransas, all but 1 have recovered. So that's good for Port Aransas. They had 7 that have had the virus, but all but 1 have recovered. And then on the recovery itself, as you can see here on this chart, we like it that this side of the donut's getting bigger and bigger. And so 32 have recovered, 32 of the 92, which is a 35% rate. And so when we first started tracking this just a couple of days ago or a week ago or so, the lighter slice was much smaller. And so it's getting bigger now, which we'd like to see. More people are recovering and fewer are getting the virus in our community through our test, at least as indicated in our testing. So hospitalizations, since we've been tracking, we've had 20 people in the hospital, either in or out or still in. As of today, there's 5 in the hospital, similar to yesterday. 1 person was discharged, another person was admitted, and through all that, we have, of those 5, 2 are in intensive care. And so that's our stat on the hospital. Okay, so one more final thing here, and then we're gonna get a Spanish translation on some of this in general. But one more thing I'm gonna do, and then I'm gonna have Annette Rodriguez come up, is just remind the community about our partnership with Texas A&M Corpus Christi. And we asked Corpus Christi, our teams at Corpus Christi several weeks ago, to help us here locally. We had seen nationally the curves on news outlets nationally of when the peak of the virus was projected, and we were working down here day in and day out, not really knowing what the virus peak and trend looked like for this region of the state. And so who better to ask than the smart persons down the street at Texas A&M Corpus Christi. And we thank Dr. Miller and Dr. Mahdi. Dr. Miller is the president and CEO of the university, and Dr. Mahdi is vice president of research. And we made a call to Dr. Miller, and without hesitation, she put together a team. 2 of our persons are here with us today, put together a team to address these questions for us. What does our curve look like? and help us with some of our analytics to include all the social distancing and stay-at-home orders. Are they making a difference? And how long should we keep them in place? And what happens when we start rolling them back? And so today this briefing will allow Dr. Tissot and Dr. Bird to provide us a third rendition of their analysis. It's being more refined because we have better data. The models are better, the data is more, and so we're going to show today some improved modeling and a little more clear, concise modeling for our region here. Dr. Tissot, just to introduce him when he comes up later on, is the interim director of the Conrad Blucher Institute, and he is an associate research professor at A&M. And then Dr. Bird, who will do the presenting, he's an associate professor of biology in the College of Science and Engineering. And today, I'm going to sit in the front here in the audience, and we've had the opportunity to work with these fine folks for a couple of hours this week, and so I'm going to kind of peer review the presentation from Dr. Bird, and if there's something that he didn't say, I'm going to, from the microphone, ask him to, hey, let's point that fact out or that issue out to the community so it's more iterative and more of a learning opportunity. Dr. Bird certainly knows how to teach. He's a tenured professor, but we want to try this out, see if there's something that he may have not covered, or slow the presentation down a little bit so the community can best learn from it. We know that there's a lot of people that watch this on Facebook and live on TV, and we're glad that you do. This is important for the community, and having knowledge and good information helps everybody get through this. So with that, I'm going to have Annette Rodriguez. First, we're going to do a Spanish translation, and then Annette Rodriguez will just do a quick update. And then we'll have Dr. Tissot come up and introduce Dr. Bird.
Recolectado 83 especímenes durante la mañana en el autoservicio de recolección. 23 de esos especímenes han sido procesados a tiempo para esta sesión y el Distrito de Salud completó los demás 60 pruebas en la tarde de ayer también. El personal y el staff terminaron de procesar este análisis de 83 especímenes colectados y los resultados fueron negativos para los 83 pruebas. Estas pruebas son el número más grande de pruebas en un solo día por el Distrito de Salud Pública. Y con este resultado de 0 positivos, terminamos una semana y un día muy exitoso para esta ciudad y para el condado. También les vamos a dar una actualización de los bomberos que estuvieron en aislamiento, que fueron reportados ayer, el capitán del Departamento de Bomberos y 6 bomberos, después de un incidente en el que tuvieron una exposición potencial al COVID, pues se hizo la prueba para la esposa del capitán de departamento y estos resultados han salido negativos del virus. Todo el departamento de personal ha regresado a sus labores normales. Queremos también agradecer la labor del líder Sam Sasser con el gobernador de Texas por su consejería y por su participación en el plan de reactivación del Estado. La ciudad de Corpus Christi se compromete a asegurar la seguridad de los primeros de los trabajadores que responden primero a las emergencias y va a tomar todas las medidas necesarias. En números tenemos un caso nuevo en las últimas 24 horas, 92 es el total número de casos, perdón. Tenemos 77 de esos 92 en la ciudad de Corpus Christi. El total número de pruebas que se han completado son casi 1,998 pruebas al día de hoy. 32 es el número de personas que se han recuperado del virus y en Port Aransas se han recuperado 6 de 7 personas que tenían la enfermedad. Solo una persona permanece enferma, pero 6 ya se han recuperado, 5 personas permanecen en el hospital y 2 de estas personas están en unidad de cuidados intensivos. También queremos agradecer la presencia hoy, en un momento más, del doctor Tissot y del doctor Bird, Ellos estarán hablando con mucho mayor detalle de los pruebas, análisis y de la información que se tiene al respecto.
Thank you. Good afternoon. Annette Rodriguez, Health Director. The Health District's next drive-through is Monday, April the 27th at 8 a.m. If you are sick and have symptoms of COVID, please call our hotline at 361-826-7200 so that you can get registered for Monday's drive-through. Please remember that the drive-through is by appointment only. As we mentioned, and the city manager mentioned as well, we had the largest number of individuals that came through our drive-through yesterday for a total of 83. And I just have to repeat it because it's such great news. So 83 out of 83 were negative results, so we were ecstatic. It shows that the community is doing their part by staying at home and social distancing, and these strategies are working. So that's awesome news. We've also had, I wanted to tell everybody about the drive-throughs. Everybody's heard them, but they don't really know how many we've had. So we've had a total of 13 drive-throughs so far. Yesterday's was 13, so Monday will be 14. So 5 of those drive-through had a total of 155 patients tested with 0 positives. 6 of the drive-throughs had a total of 188 patients tested with 5 or less positives on each. And then 2 of the drive-throughs had a total of 46 patients tested with 13 positives. All the drive-throughs combined had a total of 389 patients tested with a total of 27 positives detected through this mechanism. Drive-through events started early on in March, actually March 16th, 2020 was our first drive-through, so right around the spring break time. On March 23rd, we had the drive-through that actually resulted out our very first positive here in Nueces County. We will continue to operate the drive-through as they serve the community, and they also help overcrowding in the hospitals, and that's what we're really there to do. All of our drive-throughs have been very successful, and we hope to continue to provide this service to the community as long as there is a need. So stay well, stay protected, and stay informed. I will now turn it over to Dr. Tussaud.
El Distrito de Salud ha proveído autoservicio para pruebas de COVID desde el lunes 27 de abril a las 8 de la mañana. Esto es lo que va a tener a las 8 de la mañana el 27 de abril. Si usted se siente enfermo y no tiene ningún síntoma de COVID, por favor llame al teléfono 361-826-7200 para que puedan registrarlo para este lunes 27 de abril. Recuerden, por favor, que para ir al autoservicio se tiene que ir con cita. También mencionamos ayer el número más grande de individuos que se han dado pruebas en un autoservicio, son 83, y estamos muy contentos de reportar que todos han salido negativos. Excelentes noticias. Han habido 13 drive-thru o autoservicios en total. El de lunes será el número 14. El drive-thru comenzó en marzo 16 de este año y hasta marzo 23 fue cuando salieron 3 positivos, actualmente 6 positivos hasta el momento. Continuaremos operando este autoservicio o drive-thru conforme la comunidad lo necesite para no llenar los hospitales. Todos los drive-thru han sido muy exitosos y continuamos con la esperanza de proporcionar los servicios necesarios a la comunidad.
Good afternoon. My name is Philip Tissot from the Conrad Blucher Institute at Texas A&M University Corpus Christi, and I had my mask, but there's not too many people around me, so I'm removing it. And frankly, it's relatively easy to put a mask. Be a little careful how you handle it, and those little measures, I think, will make a difference. Will reduce the transmission, and will give us options. And before I introduce the speaker, also I'll say we're doing good in the Coastal Bend, and thank you to our leadership, our mayor, county judge, our city manager, because really we're fortunate, and the whole community. This is going to be good news again this week. So as our city manager shared, a pretty large task force was created by university president and our leadership, county, city. There's about 30 people who meet regularly, work the whole time. And our goal is to provide the best information we can, including the one that my colleague, Dr. Bird will share, the best information we can to our decision makers. couple of precisions there. We're focusing on the coastal bend. There's been a little bit of confusion between Nueces County and the coastal bend, and we understand that. So we're focusing on the coastal bend because this is the area that we're deserving with our hospitals. Our hospitals is our main focus for us, making predictions to make sure we're going to have the capacity. But we'll put in parentheses some numbers for Nueces County, such that we have both of those. Finally, I'm going to introduce my colleague, Dr. Bird. He's going to talk about the numbers, the predictions. We're running scenarios with accepted models, including one that's being used by the White House. And we're particular focus on, is the stay-at-home working? And you'll see it through the models. And I'm going to tease that we have something pretty cool based on cell phones, and that quantifies how well this stay-at-home is working. And so I'm going to leave my colleague, Dr. Bird, and stay all safe.
Muy buenas tardes, soy el Dr. Tissot, director del Conrad Butcher Institute y asociado, profesor de investigación asociada. Vamos a continuar compartiendo medidas de seguridad como esta máscara que tan fácilmente me puedo poner y quitar y disminuye la transmisión de virus. Esto es muy buenas noticias. Estamos liderando un equipo de 30 personas para proveer la mejor información a los líderes que toman opinión, que toman decisiones aquí en la comunidad. Nos enfocamos en el Coastal Bend porque hay más hospitales y queremos asegurar el servicio y la capacidad de los mismos. Ahora los dejo con mi colega, el Dr. Bird. Él se va a hablar de predicciones y escenarios a futuro. Nos vamos a enfocar sobre todo en trabajos que se hacen desde casa porque realmente funciona.
Good evening, everybody. This is the third report from the TAMU-CC Modeling Task Force on COVID-19. I just want to review some points that we covered in the first report. One, the objectives of the task force are to, one, address public concerns and questions about COVID-19 and social distancing in the Coastal Bend area, and two, to help provide our decision makers with the evidence they need to make evidence-based decisions that benefit our community. Just to reinforce this report, it's on the Coastal Bend, which includes all 12 counties, not just Nueces County. I'm not going to read them all off, but you can see them on the screen here. And the primary numbers that we present, unless otherwise noted, are for the Coastal Bend. I'll also preface this with the numbers for Nueces might have changed between this morning and this afternoon, and I defer to the numbers that were presented by Mr. Zanoni, as opposed to if any of my numbers are different for Nueces. Okay, so this is our cumulative number of cases in the Coastal Bend area and cumulative number of fatalities in the Coastal Bend area for the entirety of the COVID-19 pandemic. We're presently at 126 cases in the Coastal Bend area with 91 in Nueces by my last count, and I think the recoveries is up a little bit from 27 in the slide I saw earlier, which is only for Nueces County. We're still working on getting that recovery information for the counties outside of Nueces. And there are 2 fatalities total in the Coastal Bend thus far that have been attributed to COVID-19, one in Nueces and one in the rest of the Coastal Bend area.
Dr. Bird,
Yes.
Just on the graph, for some reason on the screen, that it's 80-20, the 100 got cut off.
Oh yeah, this is 120 at the top. That's not 20. Thank you very much. I'm not sure why that's happening, but okay, so this graph is a little bit different than one we've presented in the past. This one is scaled per capita, per 100,000 people, and we have Bexar County and Coastal Bend compared, and on a per capita basis, there have been more cases in Bexar County than there have been in the Coastal Bend, and more fatalities in Bexar County than there have been in the Coastal Bend. So what that indicates is that we were better able to, thus far, avoid the major brunt of the pandemic here in the Coastal Bend area, which is good news for us.
Dr. Bird, that's a good slide. So that's per 100,000, right?
Yes.
Okay. And Bexar County, for those that don't know, is just 2 hours north of here.
Yeah, so Bexar County includes the major metropolitan area of San Antonio. So we thought that was a good comparison for us here in Corpus Christi, being that that's the closest metropolitan area. I'm not sure why these slid over like that, but there's, for the new cases in both Nueces County and the Coastal Bend for the past several weeks, what we've done here is plotted the number of new cases per day. Each point that you see on the graph is one of the daily increases in the number of cases. You can see it's very noisy when you look at that, and what we did was we fit a model of how the number of cases should increase and decrease, and that's what you're seeing in these curves. What you can tell is from the Nueces peak, it's occurring before the rest of Coastal Bend, the other 11 counties in the Coastal Bend, so we maybe bent the curve a little bit earlier in the Nueces County area as opposed to the rest of the Coastal Bend, and you can see today that it predicts that there are slightly more new cases occurring outside of Nueces County than inside of Nueces County in the Coastal Bend area. But rest assured, I don't know what people can see out there, but this number that we're at now, both of them are at or below 1 new case per day.
And Dr. Burridge,
Yep. So this dashed line here shows you the stay-at-home, when the stay-at-home order was put in place on March 28th. And you can see that shortly after that point in time is when we topped out in terms of the number of new cases. Something else I think is important to emphasize here is that everybody's seeing a lot of different peaks, right, and a lot of different curves. The number of new cases is going to be the first of all the curves that you're seeing in the news to peak and then trail off. The reason why is because new cases are detected when somebody becomes symptomatic or shortly thereafter, and hospitalization might happen after that. And if there is a fatality, that would happen even further down the road. So the peak for something like fatalities would be delayed over what this projects. So that might be one reason why you might see something different here than what you've seen maybe on TV from other locations. So it's very important, I think, to note that our new confirmed cases are declining. It's pretty obvious. And the key thing here right now is that it's not 0. It's somewhere above 0 and below 1. And we want to be careful with what we do right now because we're almost there. Okay, this is comparing Bexar County again. That's where San Antonio is to the Coastal Bend as a whole. There's different shaped points. The triangles are for the Coastal Bend and the circles are for Bexar County. Again, really what we want you to pay attention to are the lines that are fit through those points. It really makes sense of the noise. And what it shows is that we peaked a little bit earlier in the Coastal Bend area than Bexar County did. So again, we were more effective here at bending the curve and flattening it. And maybe we didn't bear the full brunt of the pandemic, at least not as much as was experienced in San Antonio and Bexar County. But even in San Antonio, Bexar County now, we see a decrease in the average number of new cases per day, and that's a very good sign. Okay, I think it's important to review the interventions that have taken place here in the Coastal Bend area and across the state of Texas. And this isn't inclusive of everything, but it touches upon the major interventions that we've put into place. And the purpose of these interventions was to bend those curves and make them as flat as they are right now. One, we had the stay-at-home order, and I think everybody's familiar with that at this point. 2, there were school closures, so nobody's going to school right now. The university never came back after spring break. All other lower levels, K through 12 students haven't gone back to school for a while now. There's been a restriction on public gatherings. Some of the park facilities have been closed, and major venues have been closed, such as the American Bank Center and Whataburger Field, amongst others in the region. The whole reason to do these measures is to prevent a large haystack for the sparks of COVID-19 to catch in. Social distancing is ensuring that when we do go out into public, like we are today, everybody's well spaced out to ensure that we're not directly transmitting bodily fluids between each other through the air. And lastly, when you suspect that you might be sick, even if you don't think it's the same symptoms as COVID-19, you should self-isolate, contact your doctor, and seek advice on what to do from there. This will make it so that if you do have COVID-19, you're much less likely to pass it on to somebody else. So these are the measures that are in place right now for us to try to contain COVID-19 and avoid some of those dire predictions from the models that you've seen in the past. So without interventions, we can estimate the average spread rate of COVID-19 in Texas. So that's what this number is. It's approximately 3 people are infected for every person that contracts COVID-19 in the absence of any interventions that occurred. So before we realized it was here, that's how fast it spread. And we're going to have a little depiction here of how this works. So if you start with one person who's COVID-19 positive and contagious, within a week, they're most likely to infect 3 new people. So in 1 week, you go from 1 person to 3 people. Then after 2 weeks, those 3 people infect 3 more people each, which adds up to 9 people. And then those 9 people in aggregate infect 27 people the week after that. And after a month, you have 81 people that were infected by, if you can trace it all back to this one initial case. And this is assuming that we had one initial case, but probably we had people traveling in to the Coastal Bend area from various locations, and there probably wasn't just one person, but this is a depiction of how it can spread when left unchecked. And this number can only go down if, 1, people become immune through contracting the disease and then making it through it and then contracting immunity, or on the other hand, avoiding contracting it in the first place. So those are the 2 ways that we can affect this number and bring it down. And if we don't bring it down, then this is what will happen, and this is why all of those models that you've seen have shown such high peaks if there's no interventions in place and we go on with business as usual. This is what it looks like right now by our best estimate in Texas. So this is what it could be with all the interventions that are in place and with the behavior that we're all exerting to try to decrease the transmission rate of COVID-19 in Texas. We estimate there's approximately 0.5 new people infected for every 1 person. Now that might seem a little odd, but here's how it works. You flip a coin. So you get infected with COVID-19, you flip a coin, and heads, you're going to infect somebody else, and tails, you're not. That's what this means. And what it also means is that through time, we flip the coin week by week, or for each person that contracts it, and eventually tails is going to come up, and it stops spreading. So this is how that curve gets flattened. This is how the COVID-19 pandemic wands instead of accumulates in the community, and that's what's happening right now. That's why we're peaking in a lot of metrics, not just in Texas, but across the country. And we're now talking about maybe backing off some of these measures. So it becomes especially important to understand how what we're doing affects this number. Because if we back off early and the embers are still burning in the community and this number goes above 1, COVID-19 will start spreading again. Okay, so with that in mind, this week we modeled 3 scenarios, and we're kind of honing this in week by week as we go. First scenario was what happens if we continue interventions through May 31st, push it off another month. One reason to do this is that the University of Washington has recommended that the state of Texas shouldn't end stay-at-home until June. So that's where we decided that scenario made sense. 2, the scenario is end stay-at-home on April 30th, and nobody said that we're thinking about that or told me to do this, but I think we all have cabin fever at this point, and what we really want to do is end the stay-at-home so we can go back to work and so we can go out and meet with our friends. And so we're going to keep all the other interventions in place, but end stay-at-home in this scenario. And then the third scenario, which is back to normal, which would mean that we just go back to normal like we were before we knew that COVID-19 was here in the community. And each of these decisions would take place on April 30th, because right now that's the sunset, as far as I know, for the current interventions that are in place. So here's the first scenario, and we're going to reverse this a little bit, and we're going to zoom in compared to the past weeks. In the past weeks, we started with the scenario of what happens if we don't do anything, or what happens if we back off on all the restrictions. And this curve that you see right now looked like a flat line because the peak was so high on the go back to normal that you couldn't really see how tall it was or what the shape of it was. It looked like the flat line in the last 2 weeks on the graphs. So we're going to start from this perspective. If the stay-at-home, which was implemented on March 28th, stays in place along with the other interventions that are in place now, and on April 30th, we continue that through the end of May, then this is what the curve looks like for the model. We're going back to the ribbon model, which shows you the amount of uncertainty that there is in the model. This week, this is a big advancement for us, where the last time I showed you a ribbon model, it was the result of 3 different models, and that's what it predicted. This time, we did 100 runs where we randomly drew some of the inputs to the model from distributions to allow us to get a better sense of the shape of the curve. You'll notice that you've heard on TV that the curves, that in reality, they're not coming down as fast as was predicted, and you can see that here. We have the behavior of the long tail out here going into May, where it's not trailing off as steeply as it ramped up. At the top end of the ribbon that you see there, that's the kind of worst case scenario estimate, and at the bottom end of the ribbon, that's our best case scenario estimate within the estimation that we have right now. And these numbers on the side, this is 160, 120, 80, and 40. And I think it's very important to point out that for any given date, what this green ribbon represents is the number of people that are infected on that day. And so that's why it goes up and then it comes back down, because eventually, if COVID-19 burns out in our community, nobody will be infected. But we do have a very low level prediction, and that's where things get kind of hard to predict when you're down there near zero of when it's going to bottom out. Okay, so under this scenario, basically, we're going to extinguish COVID-19 in the coastal bend. However, there's competing interests that we're discussing nationally right now and on a state and local scale, where a lot of people need to get back to work. A lot of people are hurting economically, and one way that might play out would be ending stay-at-home and allowing people to go back to work. So again, I'm going to emphasize that nobody told me to do this. I just looked at the news this week, and I heard there's a fair amount of uncertainty in what might happen in states like Texas, where we are, when we try to start opening up. And so this seemed like as good of a scenario as any to run. And what you see is shortly after April 30th, which is that dashed line there, the number of cases start to increase again. And the reason why this is happening is because the stay-at-home measure is projected to have a very large impact on the transmission rate of COVID-19. In our models, the mean effect that it has is about a 46% reduction in that transmission rate. And so it looks like, at least on the worst case scenario side of things within our model right now, where you see the top end of that ribbon increasing, and attaining a number that's somewhere near where we're at now by May 31st, that within the uncertainty of the model, that's a possibility. You can also see at the bottom of the ribbon, we might be kind of smoldering for a while with a low number of cases under that scenario. We're only projecting out to May 31st because I think there's so much uncertainty now in what interventions are going to take place or be rolled back, that it's hard to make predictions even out that far, but certainly beyond that point in time. What I will point out, though, is that is not the peak out there at the far end of the graph, it would keep going if we allowed the model to keep running past May 31st. So what we're seeing there is the potential beginning of a second wave if we were to roll back, stay at home, but keep all the other interventions in place in the coastal bend area. The third scenario is the going back to normal. And just to show you the comparison between them, you can see that everything's the same until April 30th, because that's when the decision's getting made. And so if we roll back all the interventions, essentially we're going back to that transmission rate that's somewhere in the range of 3 individuals infected for every individual that contracts COVID-19. And at that rate of growth, as we demonstrated in one of the previous slides, you have a rapid increase in the amount of people that are infected on any one given day in the coastal bend area. Even within the range of uncertainty in the model, it's projecting that we would come very close by May 31st to achieving the same number of infections as we had at the peak back over here near the beginning of April in the number of infections. I also want to point out right now that I think it can be confusing because you see number of cases, number of infections. I want to be clear that we're not modeling the number of cases that test positive. We're modeling the number of infections that are in the community. So people that test positive or don't get tested at all is what these numbers represent.
And Dr. Burt,
Yes.
Just remind us about what all of the stay-at-home orders mean in this slide. It's the school, it's the...
Yeah, so the orders that are being rescinded in this model on April 30th would be all 5 that I reviewed on the previous slide. That's ending stay-at-home, everybody goes back to school, which actually we know that that's probably not going to happen. And American Bank Center opens up, the hooks are playing, and everything goes back to the way it was. We don't wear masks. We just go back to behaving like we did on February 29th, say when we didn't think it was here, but it probably was. Okay, so with that, I think that it's very obvious to me, having my hands on the dials of this model and seeing what happens when I put in different scenarios, that if we roll back some of the interventions that are in place, we have to think about how are we going to measure the effect of that rollback? How are we going to know if the transmission ratio has gone above 1, and are we predicting that maybe we need to do something else to mitigate this, to stop from COVID-19 taking off again in the community? Or how do we know that really there wasn't that much effect on the transmission rate at all of rolling back a particular intervention? And so what I put up here, for those of you that are unfamiliar, but I think most of us are familiar with the Dark Knight series, and at the end, the way that Batman saved the day was he looked at everybody's cell phones and found where the Joker was, and that's what we're proposing to do. In 2008, this was a crazy idea, and they treated it like it was going to infringe on all of the people's rights. And I think at this point, our society has come to the agreement that some of the cell phone data is worthwhile to share. And we're going to try to use this cell phone data to measure the behavior of people in Corpus Christi and at least get an estimate of how the transmission ratio might be changing. So that's what this graph shows here. We obtained this data from unicast.com. I think that a lot of people in the room will be familiar with it because they have the social distancing metric where they give each county in the United States a grade between A and F on how well they're social distancing. We took a look at that and we found that it was lacking for us in the coastal bend on this metric that we like a lot, which is the encounter index. And what you're seeing is a transformed version of their encounter index. What's trying to be estimated here is how many contacts are occurring in the coastal bend area on any given day. And so specifically, the way that a contact is defined is right here when you have 2 devices within 50 meters of each other for 60 minutes or less. If that is detected in the data, it pings as, okay, there's a contact. And then this is measured in a kilometer squared sense throughout the whole coastal bend area per day, which gives a number. Now, if you go to the website of unicast.com, you can't see what that number is, the number of contacts per day, but what they did do was they made it relative to the average of the United States. What we did was said, well, we're not really interested in how we compare to the average of the United States. I noticed that every single day that this metric is applied, we get an F in the coastal bend area for how well we're social distancing. And when you look at this graph that you're seeing here, I don't see an F, and I don't think that anybody else here should see an F either. What I see is an 80% reduction in the amount of contacts in the coastal bend area when we rescaled to how we were behaving before March 9th, which Mr. Zoni pointed out earlier. That's kind of the day that, as a country, we realized that this was really happening in the United States. That was the first day of spring break for people at the university. And that was the day that when I was on vacation skiing, I stopped going into the lodge. So we think this is a good date. It's also the exact date that unicast.com uses as their cutoff of this is the line between normal and not normal. So we look at our data here before we hit the realization that COVID-19 is real and it's here in the United States. And we scaled that to be 100. And 100 represents here's normal. Here's how many contacts are occurring on average in Nueces on an average set of 2 weeks before COVID-19, before we realized that maybe we should alter our behavior, before interventions were put into place. Now, over the next several days and weeks, several interventions were put into place up until March 28th when we had the stay-at-home order. And what you can see is that we very rapidly declined on this index, which is, again, it's essentially estimating the probability that two people will come in contact with each other at the basis level. And by the time the stay-at-home order was in place, all the other restrictions that were happening and everything we were seeing on the news was inspiring everybody here in Corpus Christi to really alter their behavior in terms of what you were doing and where would you go and who would you have contacts with. Now, since March 28th, you'll start to detect a trend there that starts to increase as we get out to the end of the graph. And that's what I'd term cabin fever. And I think that we're getting restless. And that's not just an artifact of the way that we fit the line to the data. That's a real increase tailing up at the end there. And what's happening is week after week during this stay at home, there's more people going out on the weekends. I've done a little bit of ground truthing of this. On March 28th, I went out personally in my car and drove down the SPID in the major commerce area in Corpus Christi. And it looked like Christmas Day to me for the most part, except there was a line at Home Depot with people spaced out outside of Home Depot because they were regulating how many people could go into the store at the same time. But for the most part, the parking lots were empty. I did this again on Saturday, this past Saturday, and what I saw was almost a normal day in Corpus Christi on Saturday. I got caught in traffic on Staples coming up to the SPID, driving from the bay. And then once I got across the intersection, the parking lot was close to full where I was going. It wasn't completely full, but it was a lot different than it was on March 28th. And so March 28th is right here, and last Saturday is right there. And that difference in the graph is the difference that I saw between it looking almost like Christmas Day and it looking like almost a normal day in Corpus Christi. And so it does show that difference. You'll also notice that we can look at Easter. We were concerned about an Easter bump, and you've heard on the news about the Easter bump. And I'm here to tell you that there wasn't explicitly an Easter bump. There was more of an Easter trough. Because you can see on Easter, that's the lowest amount of contacts that occurred in Nueces County since the stay-at-home was in place or across this whole time period that we looked at. However, if you look at 2 days before Easter, you'll see that bump on Good Friday and on the Saturday before Easter. Up until this past weekend, that was where the most activity had occurred since since the stay-at-home order was put into place. If you think that your eye detects a pattern there, you're right, it does. There's more activity going on and more contacts on Fridays and Saturdays, week after week in Corpus Christi, and that also happened back here, back when we were normal, than on any other day of the week. The least activity is always happening on Sunday, so when you see those bumps that are going up and down, that jagged bump in the points, that's the difference between Saturday and Sunday. Saturday with the most activity, Sunday with the least activity. Now, the million-dollar question with this graph is, how do these numbers here relate to the transmission ratio, and where's the line that we can draw on this graph that says when we go above that line, the transmission ratio is going to go above 1, and COVID-19, if it's still here, is going to spread in the community. What we can say right now for sure is that where we're at is below that line, so we're doing enough. And we've been doing enough. But what we can also see is that we're trending upwards, which can only mean that we're headed towards that transmission ratio of 1. Unless that line levels off, eventually, if you follow it out with the way it's pointed now, we're going to cross that threshold. And so this is the type of data that we're going to have our eye on in the future. And if any new interventions or rollbacks of interventions occur, we're going to use this metric or something very similar to it to assess what's happening in Corpus Christi and in Nueces and the Coastal Bend area, and how much more contacts are happening. And I think that it's a pretty logical jump that you can make to the average number of people that you come into contact with would be proportional to the average number of people that you could infect if you were positive for COVID-19 and infectious. So we're cautiously optimistic about this, but I also urge caution that we can't say that this 80% reduction in this metric equals an 80% reduction in that 3.0 transmission ratio. For what it's worth, we need a 66.7% reduction in the transmission ratio to be at 1, which keeps us level. We need more than a 66% reduction in the transmission ratio to keep stamping out COVID-19. So, in summary, good? Okay, new cases in the Coastal Bend are declining. It's about 1 or less per day on average. 2, it's most likely that COVID-19 is burning out in Texas and in the Coastal Bend area. All the metrics and models that we've run are showing that to be true. And the transmission ratio is certainly below 1, which means that this is the key metric that allows us to stamp out COVID-19. It's also indicated in our forward projecting models that if we back off of some of these intervention measures, like go back to normal, back off of all of them, which I don't think that we're going to do, or at least end stay at home, it looks like there would be a second wave that was coming without offsetting those rollbacks with something else. And so what's that something else that we can do if we want to go back to work and then stay at home? And I'm not saying that this is the magic key, but this will help. So if we end stay at home, we might need other interventions in place. And the CDC recommendation of masks in public is going to decrease the rate of transmission. And I know that it's confusing, and it was confusing to me. It's something that I had to do specific research into to figure out. Why was it that my whole life I was told that you didn't need to wear a mask to avoid getting sick, and it didn't help you? And the reason why was because we never faced a virus like COVID-19 before, which there's a high number of asymptomatic people which are still infectious, which is not the case with the flu, it's not the case with the common cold, and our healthcare system was set up to identify the people that were sick and isolate them. The reason why that's not working with COVID-19 is there's such a high rate of asymptomatic people that you can't just identify who's contagious by who's symptomatic. And that's why now, unlike any other time in my 44 years of life, that in the United States we've been recommending that people wear a mask out in public. If you're asymptomatic and you wear a mask, you're less likely to infect somebody else with COVID-19. If you're if you're somebody who hasn't contracted it yet and you wear a mask, you're less likely to contract it. And that's because the virus is traveling in particles that come out of your mouth when you're talking, in the air, particles of water, and they're breathed in by people around you. And that's one of the ways that it's being transmitted. Self-isolating when you're symptomatic, I mean, I'm guilty. I've gone into work when I was sick, and I probably never will again in the rest of my life, and I suspect that most of us are going to take it more seriously than we did in the past. It's so important that if you think that you're exhibiting symptoms of being sick, that until you consult with your healthcare professional, that's probably not a good idea to go into work, and it's probably a good idea for employers to make allowances for this in your jobs. Hopefully TAMU CC will do that for me because that's going to help to decrease the transmission ratio. More testing capacity is going to help. The reason why testing capacity helps is we can identify people that are symptomatic, not just symptomatic, but have the virus, and we're able to help them isolate. We could also potentially identify people that have had the virus and are now presumptively immune, although the jury still seems to be out on whether how much immunity is conferred and how long it's conferred for. But I heard Dr. Fauci say that he was very convinced that there would be some level of immunity conferred after contracting COVID-19 and getting over it. And there's also things that we can hope for, like new treatments to mitigate effects of COVID-19. I know that I'm not working on any new treatments, and probably most of us aren't. So these are things that we don't have control of, but we know that there's people in our society that are working towards this. And until that point in time, these are things we can do to help to mitigate the spread. And seasonality could be another thing that really helps out here, at least in the summer. If there's a reduction in the transmission ratio just because it's warmer outside and the virus doesn't last as long on surfaces, that's going to help us out also. But right now we don't know exactly how much reduction in the transmission ratio there'll be. I've read studies that said for flu viruses and coronaviruses, the average range of reduction in transmission rate is between 0 and 40%. If we get to 40%, that'd be really great, but we don't know if that's what it's going to be yet. Okay, so I'm going to end on this slide, and you can help to extinguish COVID-19 by wearing a mask out in public. It's one of the most effective things that we all can do. And thank you very much for your time, and I'll take any questions that you might have after the translation.
No translation.
Okay. Hopefully that means that everybody was on board.
Okay, great. Are there any other questions beyond the A&M's presentation? Okay, well, that concludes our press briefing for today, and we'll be back here Monday at 5 o'clock, and then on Tuesday next week, Judge Canales, County Judge Barbara Canales, as well as Mayor McComb will be here for our briefing then. We'll see you all. Have a safe weekend.